Now, I think all of you are clear. What is the basic difference between a acute wound and chronic wound? Take home point is two. The duration should be more than 6 weeks. Secondly, the entire wound healing process is stalled and the inflammatory stage has been extended. Now, what is the factors that makes an acute wound a chronic? Of course, if there is a due to some factors, internal factors, if there is an increase due to some comorbidities, there could be a increase in inflammatory mediators like different enzyme which triggers the increased levels of matrix metalloproteins. There could be infections, external infections. There could be a formation of biofilm. Now, biofilm become a major headache for doctors to treat because most of the cases, biofilm cannot be seen macroscopically. It has to be identified microscopically. Unfortunately, most of the cases, the doctor don't do sensitivity test of the exudates. Now, if we do the sensitivity test, we found that there are a presence of multi-drug resistant bacteria, which also confirms the formation of biofilms. Biofilms, if associated with the bone, that means if the infection has been spread to the bone, it is really, really very difficult to save the person from amputation. So our primary objective is to save the person from amputation. There could be a hypoxia, means lack of oxygens. You know, when there is a lack of oxygens, that means it is very important to maintain the moisture balance into the wound. There should be a lot of amount of oxygen. The wound should breathe. There should be a breathability of the skin. Otherwise, in absence of oxygen, there is a chance of growth of anaerobic bacteria. Anaerobic bacteria are those bacteria which grows in absence of oxygen and make the wound more infected, and likely it is not going to heal with the normal process. Like nutrition is always played a very important role. Although, unfortunately, in our countries, in our entire Southeast Asia and in these developing countries, if we see, the doctor treats the wound, he don't treat the other conditions. Most of the patients, they don't want to consult dietitians. Then it is our responsibility to tell the doctors, sir, please advise patient to have a nutritious food, to have a collagen rich or vitamin C rich foods. Please understand the absorption to vegetables and food of any vitamin is excellent compared to medicines. Now, this is a very important. Chronic wound, what happens? The wound healing has been stalled. Repeated rounds of oral antibiotics has not given improvement. There is a moderate improvement. One of the reasons is that most of the cases we select antibiotics empirically. We do not do the tests. We select some antibiotics and give it to our patients. Chronic wound is not an emergency. So as a company people, we always should recommend doctor, sir, before you select the antibiotic, do a sensitivity test. If there is if the if the wound is not responding, there is a suspected biofilm. Now to remove the biofilm, the best strategy as per the international guideline 2022 consensus is surgical debridement. If the doctor cannot do a surgical debridement, then there are other debridements. I'll show you the ladder what are the debridement process. But the best process is surgical debridement, which can be only done under professional guidance. Once you remove the biofilm, do the surgical debridement. After vigorous cleaning, your next step will be that how to prevent further infection or how to prevent the further biofilm formation. So you need to have a barrier dressing. So the external microorganism should not enter into the wound and contaminate it. Secondly, the dressing should contain some antimicrobial agent. And you should use the sequential topical antimicrobials. Please note this word. I have not used a word called topical antibiotics. I have used a word called sequential topical antimicrobials. Means the microbials which directly interact with the wound bed, like nanosilver particles, nanogold particles, providin iodine, beta chlorohexidine, you can use as a sequential topical antimicrobials. Then you reassess the healing and take up precautions. So you see, the wound healing is a process.